Hello, my friends and subscribers. Today I come to talk about bites by butterflies and poisonous caterpillars, medically called Lepidopterism and erucism. I will not only talk about the different families and genders, but also about their signs, symptoms and treatment. I invite you to subscribe to the channel as I will continue to upload videos of poisonous animals. Without further ado, we can continue. We say that Lepidopterism is an acute dermatitis, caused by the contact of day or night butterfly scales. The order Lepidoptera belongs to the class Insecta, and includes more than 160,000 species, where there are diurnal and nocturnal butterflies, the latter called moths. Although there are a large number of poisonous butterflies, there have been no cases of their bites except one, those of the genus Hygeia. The female butterflies of the genus Hygeia have in the distal region of the abdomen reticulating scales in the form of lanigo, which are easily detached when fluttering or on contact with the skin. In this image we can see the female butterfly of the genus Hygeia, and we see how the theory is fulfilled, since if we look at its abdomen we can see some hairs like orange lanigo. That hair comes off easily and in contact with the skin causes severe hives. The case of erucism is produced by caterpillars that are larvae of butterflies that have stinging hairs on their backs. The caterpillars or larval forms of nocturnal butterflies are pathogenic and important from a medical and toxinological point of view. There are more than 50 species of Lepidoptera whose caterpillars are carriers of reticatory hairs. We will talk about the most common medically. It is important to say that these hairs or mushrooms in contact with the skin cause acute papular and itchy dermatitis. The most important families are Megalopygidae, Saturniidae and Limacodidae. Well, we repeat it again, accidents caused by these hairy or prickly caterpillars are known as erucism. Megalopygidae family. We find the caterpillar Megalopygidae eruciscus, popularly known as Indian beard or Indian hair. Then we have the Megalopygidae laata, also called the chicken worm. This is not only yellow, it can also be white. Then we have the Megalopygidae bolivari. Saturniidae family. The caterpillars of this family are characterized by having branch-pointed spines. They are generally light green in color, which is why it is called a fine worm. Its main representatives are genus Lepidopteris, genus Turfia. In addition to the above are the genus Eruciscus and the genus Lonomia. This genus is responsible in South America for causing a serious hemorrhagic syndrome. It is for this reason that we will give greater emphasis to this caterpillar. Caterpillar family Limacodidae. This family corresponds to the slug caterpillars. These weave ovoid cocoons. The most important species are genus Sabin, genus Phytron, also popularly known as spider worm. Also enter the genus Stop and the genus Euclea. The venom of those animals is found in the hemolymph and also stored in tubular and tegumentary glands connected to mushrooms and spines, which through contact with the skin through a mechanoreceptor mechanism, the device is triggered and the poison penetrates the skin and causes symptoms. Local and even systemic can become very serious. The poison, in addition to histamine, serotonin, acetylcholine, may contain a proteinaceous substance, which, when acting on mast cells, disintegrates them, releasing histamine and serotonin, responsible for the symptoms. In its symptoms we have three types of symptoms: local, systemic and one that occurs by contact with the eyes. In the first case the symptoms are burning pain, itching, edema, erythema, pupilly and anomgaly. Those of a systemic order are unassociation, nausea and lipothermia. When the contact occurs in the eyes, it occurs ophthalmia that can lead to blindness and subsequent enucleation, that is, the surgical removal of the eye. In the treatment, it always consists first of doing a good wash and applying cold compresses with water and ice. We can use local anesthesia such as lidocaine, antihistamines, analgesics for pain and local corticosteroids. We can also use an adhesive tape to remove the mushrooms that have entered the skin, since many release their mushrooms on the skin when biting. A serious form of erucism is caused by the Lonomia genus. For this reason we have prepared a little more detailed investigation. Geographical locations where we find the genus Lonomia. 1. Species Lonomia aeschylus is present in Venezuela, French Guiana and the eastern region of Colombia. 2. Lonomia diabolos is present in the north of Brazil and in the delta of the Amazon River. 3. Lonomia obliqua is distributed in Brazil mainly in the Grande do Sul and Santa Catarina region. The venom of this has a coagulant, fibrinolytic and P.L.A. 2 activity, which results in hypofibrinogenemia, fibrinolysis, a decrease in coagulation factors 8 and 5, plasminogen and alpha-2 antiplasmin. Lonomin 5 is a purified proteolytic enzyme from Lonomia venom that degrades factor 8. Clinical symptoms of the sting of the genus Lonomia. The clinical symptoms are characterized by burning pain, edema, erythema, heat, blisters, occipital headache, generalized pain. Hemorrhagic syndrome can appear in the following 48 to 72 hours after inoculation, and manifests itself in the following ways: extensive ecchymosis and bleeding of mucous membranes, vagina and intestine, ears and wounds. The most serious cases present cerebral hemorrhage and kidney failure that rapidly causes death. Treatment of the bite of the genus Lonomia. It consists of the administration of antifibrinolytic drugs such as xylon caproic acid or aprotin, but the most efficient measure is the application of equine antivenom produced in Brazil. Administration of whole blood, fresh frozen plasma, or cryoprecipitates should be avoided as it can cause disseminated intravascular coagulation. Samirrufa primulis. They are from Brazil, and they cause deformities due to interphalangeal periarthritis in the fingers of the rubber tappers or collectors of Kygo tree latex. This disease is known by the name of pararymosis or rubber tapered rheumatism. Thank you very much for watching the video. If you liked it, give it a like and subscribe to the channel to upload more videos of poisonous animals. Greetings.